just releasing some lower back pain for my client using my therapeutic ancient massage, or it's sometimes called yoga massage therapy. And the massage involves a combination of acupressure points, assisted stretching, and warming or palming as it's called, or massaging. And for lower back pain, it can sometimes be started with an array of situations that really cause the back pain as the catalyst of the back pain. Sometimes it can be a foot, knee or hip injury, for example. But quite often it can be for tension right in the top of the psoas, in the abdominals here in the tummy. So if the client has had a history of room operations, for example, or anything like that, there can be tissue scarring that could cause the tightness, and that can really cause intermittent lower back pain. So we're just going to work on that. So basically we do gentle waves across the tummy to just release and warm up the tummy muscles. So it's like just a little wave, and very gentle, and always to the client's pressure point that they can handle, and no more. So warming up, so after a little bit of warming up through the belly, and maybe on both sides, and then I might do some acupressure therapy, which is just a little bit of palpation through the points, through the abdominals at certain points. And if it's on one side that you notice the tightness, you can work a little bit deeper. Now you never go in very full. It's always, like I say, to the client's point of pain threshold basically, but just before that obviously, and you just warm up into those points. Now they can feel sometimes, it doesn't affect the organs or anything, it's absolutely quite safe, but sometimes they can feel a little bit of tingling, or some clients even might start giggling, but we just massage into that to release it. And also, because the psoas comes from the top here to the abdominals into, and the pelvis into the hip joint and into the quads, top of the thigh here, so sometimes it's good to do the quads as well. So just warming up into the quads, again very gently, and although this might appear like it's quite strong, but actually I'm doing it very, very softly. Also the points along here, this IT band they call it, can get really, really tight, so that can be also worked with acupressure point, massaging and releasing. Another symptom of back pain can be or cause back pain could be tight hamstrings. So I might, with a bit of assisted stretching, do a little bit of stretching through the back of the legs, and obviously on the other side as well, it might be massaging the back of the legs, but just stretching out through the hamstring very, very gently. And then also obviously just getting a little bit of mobility through that hip joint, really, really gently to their point of mobility, and obviously working through the piriformis as well, and the tightness, and sometimes the pelvis can be twisted, so I would be correcting that as well. So I'm just going to roll my client slightly over on the hip, and again, not all clients would be able to do that, but obviously I would adjust and modify. So I'm just going to work through the piriformis here, the glutes, and the acupressure points around here to release the lower back. Sometimes another point can be the waist muscle here, the QL, that can get over tight, so that might need some work and stretching. So if I can ask you to lay on your side. So also the stretches, assisted stretching, so that psoas that I was talking about, to release up into the belly, is good to be stretched as well. So I'm just going to do a little stretch for her and just bring that leg back. Now I'm supporting her lower back, and we're just going to do some breathing and stretching and releasing. So take a breath in and breathe out, And I just go to the point where it feels resistance, and then release, and supporting her lower back the whole time. Breathe and release.